now it's time for our rapid podium presentations. So can I ask our presenters to come up? I'm going to introduce everybody. So our first presenter, poster number 2, is Miriam Farag from the University of Toronto, facilitating concussion research participation, a qualitative study exploring patient perspective. Our second presenter is at poster 7, Evan Foster from the UHN, remote versus in-person follow-up in acute concussion care, examining recovery in pre and intra-pandemic cohorts. Presentation 4, poster 9, is by Ethan Daniele at UHN as well, preliminary findings in MRI study tracking post-concussion brain recovery. The fifth presentation, actually the fourth, because one of our presenters wasn't able to come today. So the next one is poster number 10, Melissa Biscardi from University of Toronto. And her presentation is on rehabilitation interventions for oculomotor deficits in adults with concussion or mild traumatic brain injury, a systematic review. And the final presentation, poster number 11, is by Teza Tilinsky Santana from the University of Toronto, The Power of Images Using Infographics to Promote Patient and Family Understanding of Sex and Gender Effects in Traumatic Brain Injury. So, Miriam, do you want to take the mic?
Hello, my name is Mariam Freeg, and I'm here to present the highlights of our study about patient concussion participation. So the purpose of the study was to explore the perspectives of adult concussion patients in terms of what matters to them when it comes to participating in research studies. So we saw a gap in this literature because they're focusing specifically on adult concussion patients, even though there exists material about recruitment and retention in general. So to support the aim of improving uptake and supporting research with the ultimate goal of improved patient care, we recruited and had a qualitative study. Our findings were then used to produce 2 handouts, one aimed at researchers and one aimed at patients. It was a qualitative description study that we did using semi-structured phone interviews with adult concussion patients. They were our purposive sample. The questions were guided by appreciative inquiry as a model. So that focuses on the positive experience. And the reflexive thematic analysis was used to perform on the interview transcripts. So all the participants were recruited from 3 tertiary care concussion clinics across Ontario. All of the patients were associated with a separate Connect study, and so had consented to be contacted for recruitment. They all had persistent post-concussion symptoms. Actually, all of them had at least 3 months of symptoms post-concussion before they were interviewed. In total, 23 interviews were conducted and saturation was reached at the 19th interview. So the first theme was about positive change. So that captures the motivation for them to participate in research studies. The 3 sub-themes were study impact. So the reputation of the institution attached to the study mattered to participants. That had to do with the trust that they put into the data that was being collected by them, along with what they saw as the potential impact of participating in the study. You also had a personal contribution. So they wanted to help other patients along with helping themselves. And then in information and reassurance, they wanted information about concussion, but they also wanted information about their own condition. So a lot of participants were looking for reassurance about the state that they're in. They wanted to be compared to other patients. They wanted to get access to study results. So there were a lot of motivators for participating to learn more about their own concussion. The second major theme was patient-centered study design. So those included factors that were seen as positive and that they appreciated as participants. So that included convenience, such as the time and cost involved, accommodations. So limiting the screen time, for example, taking into consideration memory problems, And then feeling valued, again, big emphasis on getting information, so getting the results along with being treated with respect. And finally, so many of these factors were discussed in other papers, but access information is a big motivator. And so that may reflect a lack of knowledge about concussion care. So we will be producing handouts, as I said, but some of the suggestions for researchers include considering accommodations, making clear to participants what kind of care they will actually receive as participants, producing results that are in plain language with visual aids that are easy with summaries, and to thank them, make them feel appreciated and respected. Thank you.
Hello, everyone. So I'm just going to be talking about preliminary findings from a study that we're using MRI to track post-concussion recovery and looking specifically at the brain. And so just to declare, I'm research projects lead for TBI Finder, which is I'm partially funded through my tax for. So as you all know, concussions can present very differently with all different kinds of symptoms, and collision sport athletes are put at an increased risk of sustaining concussions. And unfortunately, routine clinical CT and MRI still fail to detect concussion-related injuries. And from the research perspective, network connectivity and group-wise analyses have kind of trouble translating into the clinical space in terms of giving an actual patient assessment. So the purpose of this project was to track recovery post-concussion using our personalized MRI methodology to try and compare their brain recovery to their post-concussion symptoms. And so we hypothesized that at the acute stage, brain abnormalities would align with symptoms, but the brain abnormalities detected by MRI would outlast the symptoms. So at this point, it's a study that we'd like to recruit 50 patients for, but we've started with 2 acutely concussed within the last 2 weeks, both male, and we collected their PCSS score as well as an MRI session where we collected a T1, a resting state fMRI, and then a diffusion tensor image. Acutely post-concussion, and then again at 3 months. And so basically we analyzed the MRI data using the TBI Finder software to implement their ROI-based C.E.T scoring analysis, where we could analyze the temporal complexity of the resting state signal across 29 different gray matter regions, and then fractional anisotropy of the diffusion tensor imaging across 18 white matter regions. And this included the incorporation of 162 age and sex matched healthy controls, and brain regions were abnormal if they exceeded 2.5 standard deviations away from the healthy control. And so at the acute stage, looking at participant 1, they had a PCSS score of 17, but had 9 abnormal gray matter regions. As you can see in the figure, the darker the color, the more severe the abnormality. And at 3 months, their PCSS basically was cut in half, but the gray matter regions remained consistently injured. And the same trend was for the other participant, where their PCSS score went from 7 to 1, but they still had quite a large number of brain abnormalities after 3 months. So basically, we found that this technique was very helpful to try and figure out what's going on in each participant's brain from a unique perspective. And we found that the post-concussion symptoms may actually overestimate recovery of the brain even after symptom resolution. But obviously, we would like to continue the study with more participants. Thank you very much.
Hello, everyone. Thank you for having me. I'll acknowledge my co-authors and funders. Oh, sorry. Hi there. Thank you for having me. So, as has been alluded to earlier today, concussion is a huge problem. And in fact, it's estimated that half of the world's population will sustain a head injury at some point in their life. That means half of this room. And the majority of those will be a concussion. Persistent symptoms of concussion are often suggestive of ocular motor deficits, such as blurred vision or headaches when reading. And ocular motor rehabilitation is offered by a number of allied healthcare professionals already, but the utility of these is currently unknown. And so we performed a systematic review and meta-analysis to synthesize and critically appraise the research on oculomotor rehabilitation in concussed adults. And we did aim to apply a sex and gender lens and, of course, identify directions for future research. Now, it might be surprising or it might not be surprising to you that we only found 8 studies of low quality, and these were, these were 7 case series and 1 crossover study. And we determined the quality of the evidence using the C.E.T.S and NIH quality assessment questionnaire. The interventions reported varied in duration, content, a homework component, and the outcomes that were measured. And there was a lack of sex and gender considerations throughout. 1 study did not even report the number of males and females. So our preliminary results, we were able to attempt a meta-analysis on all of the studies that reported on an outcome, any outcome that was reported on in 2 or more studies. And this included symptoms of convergence insufficiency measured by the convergence insufficiency symptom survey, also near point of convergence and reading rate. And we found a trend in the benefit of oculomotor rehabilitation, or after this intervention, it appeared that these outcomes improved. Now, huge gaps, there was no sex and gender analysis, there was a lack of control group, so there is a wide open field for future rehabilitation, and we definitely need a randomized control trial looking at oculomotor rehabilitation compared to usual care, also applying a sex and gender-based analysis, and looking at is earlier intervention better, associated with better outcomes, would also be a goal for future research. I look forward to your questions and comments on our poster.
Thank you very much to all of our rapid podium presenters. Covered a wide range of territory there, really interesting topics. And so you can get if you have any questions for these presenters, you can and should go to their posters now. It's time for our break, and you'll have 25 minutes thanks to the punctuality of all of our afternoon presenters. That meant I didn't have to impose any draconian measures to keep them on time. And I just want to give one more round of applause to our first set of speakers this afternoon.